We are pleased to introduce the College of Family Physicians of Canada's newly installed president for 2018 and 19, Dr. Paul Sawchuk. Welcome, Dr. Sawchuk.
Thank you. Great to be here.
You have been involved in medical leadership throughout your career. What motivated you to join the CFPC executive and serve as president?
Well, the college is a great organization. I've been involved with the college for several years. I started initially serving on a couple of committees and then as chapter president of our provincial chapter, and then I joined the national board. The college is all about supporting and challenging family doctors to be the best that we can be. So the college has programs, continuing education programs for us. For me, I was also found mentors and tools for practice with the college. The college is involved in accrediting the residency programs, accrediting CME programs, even developing CME programs. The college has been involved with developing the patient's medical home model and the family medicine professional profile. So it's a wonderful organization to be part of. When the chance came to join the executive and become even more involved, I jumped at the opportunity. It's a great way to serve my profession.
What is one initiative that you have been involved with at the college that has had a meaningful impact on how you practice?
Probably the most formative initiative for me has been the development of the patient's medical home. I was lucky enough to get involved early when it was being developed, and that I could see the collaborative way that decisions were being made. And then I was able to take that back to my practice and think, how do we implement this into our practice? What should we do? What would we do? What could we do? And then we were talking with our colleagues, and it really helped us develop a way to best serve our patients.
You include home visits as part of your work. Can you tell us why you are passionate about home visits?
Well, I am really passionate about home visits. Providing care to people who can't leave their home, I think, is a very important part of what we do. I first became aware of this issue when I was chief medical officer of a hospital in Winnipeg. And I became aware that there was a population that couldn't get out of their houses to go and see their family doctors. And so this group went without preventive care. They went without chronic disease management. And then when they became acutely ill, they had nothing that they could do except phone an ambulance and go to the hospital. For me, it is a little bit time intensive to go and do home visits, but it is easily one of the most rewarding things that I do.
Can you tell us what makes this an interesting time to be involved with college?
Well, it's an interesting time to be involved with college because there's so much going on. We just finished producing the Family Medicine Professional Profile, which helps to define us as a profession. Now we are looking at the Outcomes of Training project, and that's to make sure that we are accomplishing everything that we want during the 2-year residency program that we want to accomplish. Coming up in January, we're going to be releasing the Patient's Medical Home 2.0. This is a complete refresh of the patient's medical home model that has had such a positive impact on primary care and family medicine across the country.
Thank you, Dr. Sawchuk, for joining us today. We're looking forward to working with you in your year as president and wish you the best of luck.
Thank you.